Hello, welcome back to my YouTube channel. Paramedic Coach. What is meant by cardiac arrest? It is a condition in which the heart suddenly and unexpectedly stops beating, and the cessation of blood flow occurs towards the brain and other vital organs. What are the causes? Most common cause of sudden cardiac arrest is the diseases that are occurring to the ventricles. 1. Coronary artery disease. 2. Severe physical stress. 3. Structural abnormalities. What are risk factors? Abnormal heart rhythms. Birth defects of the heart or blood vessels. Previous myocardial infarction. Coronary artery disease. Family history of SCD. Cardiomyopathy. Congestive heart failure. Long QT syndrome. Excessive alcoholism. Smoking. High blood pressure. Pulmonary embolism. High blood cholesterol level. High blood pressure. Diabetes mellitus. Increased age. Overweight and obesity. Clinical manifestations are absence of pulse, unresponsiveness, no respiratory movements, no blood pressure. Pupils begin dilating within 45 seconds. Seizures may or may not occur. Death, like appearance, lips and nail beds turn blue and skin turns pale. Diagnostic evaluation. 1. History collection and physical examination. 2. Electrocardiography. 3. Cardiac catheterization. Picture shown to understand placement of catheter. 4. Echocardiography. 5. Holter monitoring. 6. Exercise stress test. 7. MRI studies. 8. Blood studies. Management. In the pharmacological management of cardiac arrest, the drugs include ACE inhibitors, beta blockers, and calcium channel blocker. Antiarrhythmic drugs can control abnormal heart rhythm. Drug therapy alone will not be effective for reducing cardiac arrest. Next, we're going to learn about CPR. Cardiopulmonary resuscitation is a technique of basic life support for oxygenating the brain and heart until appropriate. Definition: medical treatment can restore normal heart and ventilatory action. Purposes of CPR: to maintain an open and clear airway, to maintain breathing by external ventilation, to maintain blood circulating by external cardiac massages, to save life of the patient, to provide basic life support till medical and advanced life support arrives. What are indications? Cardiac arrest, respiratory arrest, drowning, foreign body in throat, smoke inhalation, drug overdose, suffocation, accidental injury, coma. Principles of CPR: to restore effective circulation and ventilation, to prevent irreversible central damage due to anorexia. When the heart fails to maintain the cerebral circulation for approximately 4 minutes, the brain may suffer irreversible damage. Standard method of CPR. CPR has been ABC, A for airway, B for breathing, and C for compressions. But recently, the American Heart Association, AHA, has changed it from airway, breathing, and circulation, ABC, to chest compressions, airway, breathing, CAB. Steps in CPR. Before starting CPR, check: is the person conscious or unconscious? If the person appears unconscious, tap or shake his or her shoulder and ask loudly, "Are you okay?" If the person doesn't respond, call the local emergency number and begin CPR. Circulation. Restore blood circulation with chest compressions. Put the person on his or her back on a firm surface. Place the heel of one hand over the center of the person's chest. Place your other hand on top of the first hand. Use your upper body weight and compress the chest at least 2 inches. Push hard and fast at a rate of about 100 compressions a minute. Chest compressions to restore circulation. Airway. Clear the airway. Open the person's airway using the head tilt, chin lift maneuver. Check for normal breathing. Look for chest rise. Listen for normal breath sounds and feel for the person's breath on your cheek. If the person isn't breathing normally, begin mouth-to-mouth breathing. Breathing. Rescue breathing can be mouth-to-mouth breathing or mouth-to-nose breathing. Using head tilt chin lift maneuver, give 2 rescue breaths. 30 chest compressions followed by 2 rescue breaths is considered 1 cycle. Continue CPR until cycles are completed. If the person has not begun moving after 5 cycles, administer 1 shock by using automated external defibrillator, ED. Continue CPR until there are signs of movement or emergency medical personnel take over. Thanks for watching my video. Please subscribe, like, and share my channel.